si nani alikuwa na nini, kwa hivyo hata mimi niko sawa. That statement, mimi I believe that just because somebody went through something does not mean you have to go through them. And we are all built differently. Every woman is different. Your circumstances are very different. You may find a lady who has 4 nannies and she still goes through postpartum depression. The people who can be able to afford 4 nannies. And there's somebody who would be like, mimi nikakuwa na 4 nannies. So every circumstance is different. Those, as you said, one, craving stones is not normal. I'm sure you know what this is. This one. Eh? I've never actually tasted this because I've never craved this. So today, these are those stones that ladies actually say they are craving, and their system just wants to eat when they are pregnant. Like you just hear eating, chewing stones. That is not normal. You need to get checked. And those are some of the things we help you check. And as I said, we take you through the diet, lifestyle, and if you can, prepare for your pregnancy so that you're able to avoid some of these cravings. And immediately you know you've missed your period, go to your healthcare facility. That's where you come to us, we tell you X, Y, and Z. And then you liaise with the obstetrician gynecologist. Because we may teach you about the diet and the lifestyle, but you also need a gynecologist for the end of it all. Kwa sababu sijambo umeisikia watu ambao wana lose meno, watu ambao wamefaint, or rather their heart has become bigger when they were pregnant. You developed diabetes when you were pregnant. A thyroid condition came up. Blood pressure ilikuanza. And imagine you did not go to the hospital. So please, ladies, let us go to the hospital. Number 2 is that hollow feeling of hunger postpartum, like when you're breastfeeding. That is normal. Hiyo njaa ya kufaint, hiyo ni normal. Like it's not you're not sick or something is wrong with you. No. The cravings that usually happen, they are bound to happen because of hormonal changes. So that is expected. I've had very many theories. Cravings happen because watu wanajifanya, pregnant ladies wanajifanya is one. You just want to disturb. It's the moment you can disturb your spouse the most. But the reason why you find yourself craving some of these foods that actually have no nutritional value, e.g. these stones, there are people who actually eat ice cubes from the fridge they take and they just munya on it. And that's the thing that is just maintaining their tummy, like you don't get the nausea and all that. And there are others who are out here craving all the type of processed foods and things like that. Moms, I understand you. And I understand the cravings. Most of them will come from her hormonal perspective. But you can be getting the cravings because you're deficient in certain vitamins and minerals in your system. This is why we are insisting, please, 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 please go to the hospital and get checked. Immediately you realize that you're pregnant. And by realizing you're pregnant you've missed your first period. Sometimes people come to the clinic and they say, I've not seen my period for the last 4 months. The moment you noticed it, the first period was missed. Hiyo ndio time ambayo ungekuja. Because within the first trimesters, when a baby is being made, that is from 0 to about 12 weeks, roughly 12, 13 weeks, is when we are making the baby. All the different body parts are being made. And that is where you actually need those important nutrients. Unaona zile daktari wanashinda akisema wapeeni IFAS, wapeeni folate, wapeeni hizo pregnancy vitamins and minerals. Your first trimester, they are very important that our babies are formed properly. Now, you need to be going for your ANC visits. And we usually recommend about 4 ANC visits. ANC visit ni kumaanisha nini? Sawa. Si umemiss period yako, umeenda hospitali, ama umenunua that kit for 50 bob that checks. Unapata, iko na tulain tuwili. Okay, you've gone to the hospital. And then they've checked and confirmed, yes, for sure, you're pregnant. Okay, what else will they do? Number 1, they check to some blood test. Wataangalia HIV status, wataangalia hepatitis, they check the urine, they check your sugars, just to ensure that just to confirm how things are so that you can actually receive care. The main aim of you getting checked, si ati ndio upate stigma, is just so that we can help you moms out and your baby in the long run. So when they check, they give you a report, and then in the middle of the pregnancy, depending on the trimesters, they'll actually recommend a scan. The scan, especially in the beginning of the first trimester, ni ya kujua how the baby is, where the baby is, cause womb ni kubwa ama nyungu ya mtoto or the uterus, the baby might be held in different positions. So we want to know kama ako held in the right position. Number 2, kama mtoto pia ako sawa, so that we can give you further advice. Now, once we've done the test, we've done the imaging, and you'll be advised where in the period you'll do the imaging. There comes the follow-up routines. Ile yenye unafuatiliwa, how you're doing. So utaandikiwa tu mahali, and most ANC visits are actually free in this public health hospital. So please, 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 for the sake of your health and the sake of your baby, please go to the hospital. And you might find hata ujampa mtoto mmoja, ni wawili ama watatu. So please make sure you go. For men, and I think this is directed to men because at times they think we are pretending or we are misbehaving or we are seeking attention or something of the sort. When you find that your spouse is crying a lot postpartum, they're just crying. You ask them why they are crying, they can't explain. You just find them seated in a corner. I just need some time. I just need some time. Don't let somebody cocoon themselves. I just need some time. You need to approach it from a very different perspective. Anakwambia tu hapana, staki, sijisikii. Something is wrong. And especially that crying. You're just crying, you're in a corner, you're crying, so you're feeling. Yes, it's a very weird kind of time. And especially for husbands, sometimes they feel very confused. Okay, I asked you why are you crying and you're not answering the question. So, and men are logical. Like, there needs to be an answer. But it's a hormonal, emotional kind of response because of the changes in your hormones. And worst of all now, if you've been extremely stressed, there's excess cortisol in your system, which is now a whole different conversation. Postpartum depression can now end up in postpartum psychosis. I don't know if you've ever heard of mothers who killed their babies. Now, those ones have tipped over into something else. Because the natural response towards the baby, this is somebody who can't defend themselves. So some have drowned their babies, choked them, pressed them on the bed, something like. Now you're tipping over into psychosis. Some have left the home. They left and they went. After 1 month, 2 months, 3 months, they disappeared away from the child. So when you're in that period, immediately when somebody is going through from the point of anxiety, blues, that's why I said you need a support system. When you notice the mother is getting into postpartum depression, please get them help. It is not a bad thing to get someone help. It does not make you weak. It does not make you inferior. Please get them help. Because when you get them help, they are able to express themselves to their psychologist or their counselor about what they are going through. Somebody who can be able to understand them. Your periods. People's periods come back differently. Because see, you are not having a period for the last approximately 1 year, 9 months to back. And then your periods, poof, you're shocked. You're thinking, lakini si ya Nancy ilikuja after 1 year, mbona yangu imekuja different? Hormonal changes. We are all different. Some people stay 1 year, but the longer you breastfeed, there's something you asked about lactational amenorrhea. Breastfeeding, because of the hormones involved in breastfeeding, actually work together to prevent the period from coming. So the longer you stay without breastfeeding, now your body thinks it's going back to status quo. Right? Nancy is going back to the status quo of not being pregnant, of not being, of not carrying, of not breastfeeding. So your period, your hormones involved in period and menstrual cycle start coming back. So the longer you breastfeed, meaning your frequent breastfeeding, 2 to 3 hours, 2 to 3 hours, month 1, month 2, month 5, month 6, your period stays long. Kuna watu period zao zinarudi na 2 weeks, 6 weeks. So people are different. Contraception use after giving birth. That is a whole interesting topic that should be had. have that topic with your healthcare worker. Stop deciding, see, I had an IUD, so now I'm going back for the same thing. The reason why I say you need to have that conversation with your healthcare worker is because you remember the way you're puffing up postpartum. Some of these hormonal contraceptives, utajipata umeongeza kilo and ikatai kwenda. Umemalizana na baby 1 year, 2 years of breastfeeding, imekataa kwenda. You have tried gymming, you have tried changing your diet, you have just tried, it is refusing. You used to be a big girl at 55. Now you're 90 kgs and it has refused to go. You need to work with us to help you move back. So don't just decide you're taking a hormonal contraceptive because you're used to. And also, remember, because of pregnancy and postpartum, sometimes you may develop issues with blood sugar, blood pressure. So, of course, the mode of contraception that you decide to use actually matters depending on a condition that you have. There are people who, even before they give birth, they already start noticing breast milk is coming out before they give birth. So it can happen, so that should not surprise you and make you so weird. And immediately you give birth, it's surely advocated that you start breastfeeding your child within the first 30 minutes to 1 hour. Sometimes it may not happen because maybe you went for a cesarean section and it took longer than usual, or God forbid there was a complication. You had to be taken for post-op care, and baby had to be taken to be seen by a pediatrician. So sometimes it may not happen, which you have to be gracious with yourself this month, because you'll start feeling bad. There are things that you're usually told before you give birth. Let us all give birth vaginally as much as possible, and then you end up with a cesarean section. And then you start feeling bad. That is already a process that has started. You mentally put in your head that I'm not a good mother, that I give birth. No, as long as you've given birth to a healthy baby and you're also healthy, you're okay. Both of you are okay. Don't feel bad about it. What I have come to learn is be gracious with yourself this month.